G'day there, and welcome to today's episode. I've got a great interview with Darren Ross, who is a physiotherapist who is also CEO and co founder of a company called Patient Notes. Now, Patient Notes is an app that uses AI to be able to automatically take notes, write doctor referrals, and do a whole bunch of other stuff while you're in your consultation. So it's kind of at the cutting edge of technology, being able to save practitioners up to 2 hours a week that you would otherwise be spending manually writing notes and getting those kind of details down. Plus, it allows you to have a deeper connection with your clients while they're there in the room because you're not looking off at a computer or doing something else. It's like having an assistant sitting in the corner taking your notes for you. So it's a super interesting concept. It's something that's still kind of new because AI is still being developed and we're seeing how it's going to be able to engage with the health professions. And so it's been really interesting to have this amazing interview with Darren, who is a fantastic practitioner in his own right, very experienced, has run a bunch of clinics, and is now one of the heads of this software that is changing the game and looks really, really great. So have a listen to this interview, see what it is Darren's all about, and go check out the software itself if you want to have a go. Fantastic to have you here, Darren. I'm really excited to hear what you've got to share with us today. For people listening, Darren is the CEO and co-founder of Patient Notes, as well as being a physio for a long time and a great health practitioner in his own right. Patient Notes is AI software designed to help take clinical notes, to do some letter writing and other things that are kind of on the admin and compliance side of running a clinical practice. So I'm really excited to have you here, Darren. AI is like a big and exciting thing that's happening in the world at the moment. And it's one of those things that it's going to be interesting to see how it impacts such a hands-on environment as things like physio, massage, and other health professionals. So welcome. And I guess first thing is share a little bit about Patient Notes. Tell us what this is about.
Yeah, thanks so much, James, for having me on board. Patient Notes is exactly what you mentioned there before. It's a tool that can write clinical notes, letters, build reports by three different ways. It can either listen to the whole consult, which is what we call ambient AI. So it sits in the corner of your room. It's like a virtual assistant that does your notes exactly how you'd like it to be outlined. It includes things that are pertinent to the consult, and it can actually exclude a lot of things. So it doesn't just pick up the general rapport that we have with our patients. And then from there, you can build your notes. So literally in a matter of seconds, your notes are done and can be imported back into your practice software. You can then give your patient client a summary of the session, the real key take-home messages that you've talked about during the session. That can even include things such as when you're going to see the next exercises, advice, and so on. So things that would normally take a bit of time to build. And then the great thing from there is that you can ship off letters to their medical team, to the referrers who sent them across, to friends and families. So it can help to build your network. And it's just the situation whereby it saves most practitioners around 2 hours a week of admin if you're on a full diary. Helps with compliance, helps with your referral. It's sort of a win-win system. So yeah, it's amazing tech, and I'd just love to delve in a bit more with you.
Yeah, it sounds really great. And I do know I work a lot with massage, my therapists, a few physios and that sort of stuff. And taking notes is something that a lot of people, as they go through the day, they'll do it in between or after they've seen a patient, sometimes during the consultation. But I do know it's one of those things where some people will be like, oh, at the end of the day, I've got to catch up on all the ones that I missed and I've got to tidy them up. And it just adds that kind of little bit of frustration at the end of the workday to have to do that. So I guess I want to really ask, like, how good is this AI? Like, not just patient notes, but the AI note taking in general. Is it something where people will still have to go back at the end of the day and tidy up, or is it like pretty perfect? What's it like?
Yeah, the key to the output is really much on how you set up your prompts and your templates. So hopefully after the session, everyone can go on and they can download a trial and they can play away. And you'll find that they have default prompts that will pick things up and they'll do a great job for a lot of people. However, not everyone's notes are going to be just vanilla. Some people will want different language, style. They want their own personal content that's being picked up. And that's where knowing about what we call prompt engineering or creating better prompts to output is what I liken the analogy to is that virtual assistant. If you've got somebody who's come on board and they can sit in the corner of your room, they don't see any parts, but they hear all aspects of the consult, and they document it exactly how you want. If you didn't give them instructions how you want your notes done, then it's going to be mixed and varied. And it's that whole standard deviation curve whereby if you want really detailed notes, you can build that. If you want simple notes, you can do that. So just giving a brief to the prompt on, or the system and the profile of how you want it, the format, the language, the style for not only the clinical notes, but the letters, it gets really, really good. And you can get it to being about 99% accurate. And we still do encourage, it is a document that you should have a look over before signing off on. If you found that, hang on, it's more 85, 90%, it's just then a matter of tweaking either your prompts or your style of how you might ask something or explain something. We often have a lot of practitioners that go, oh, hang on, it didn't pick up in my notes. And they go back through the transcript because the session does generate a transcript from the audio. So you can go back and see that. And it hasn't been included in that. And it might be that the practitioners thought it, or they might have just pointed to something, but not sort of said, okay, James, I can see it's your right shoulder that we're going to work on. If you just go, does it hurt here, 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 or here? Then it's not going to pick up as accurate. So there's an element of prompt training and practitioner training.
That's super interesting. And I love that it might even actually be more accurate than your own memory, right? It's like it's got an actual transcript there, then it's literally picking up what's in the room. Yeah. And that could be a feedback loop that can help the practitioner become better at communicating with the client as well. So that's kind of cool.
I can't share enough times whereby we've heard these stories from people who have actually sort of, and all different practitioner types that have sort of said, oh, I didn't think I said this, and I went back and I thought the system was wrong, and I was wrong, and the system was better than me. Or similarly too, a lot of, as I mentioned before, a lot of practitioners think that they do things, and we've found that, hang on analyzing the transcript, I'm talking over my patients a lot. I'm actually not capturing their feedback loop, and that's a really good self-reflection to become a better practitioner.
Yeah, for sure. Do you ever think it'll get to a point where AI is actually helping diagnose this stuff? Like that's what comes to mind when you're talking about this. If it's listening to you talking to a patient, can or will it ever give advice?
We can already do that. Other systems can already do that. We do turn that functionality off because we believe that it's really important to maintain the clinician's clinical reasoning skills and the emotional intelligence that AI will never, ever have. Like AI is an algorithm. So it will tie in and say, okay, if A plus B equals C, therefore it must be diagnosis D. However, it's not picking up on those other cues that us as human to human is so powerful. And it's one thing that I often relate to is when a patient comes in and they're parents brought up a young child in. And over almost 30 years of clinical practice, I've learned to really carry heavily the parent's intuition of what's wrong with them. Obviously, again, there's things that outliers on that. But that emotional intelligence, that reflection of a parent knowing the child or a practitioner knowing the client, that will never be replaced in the world of AI. But we can make diagnoses or provisional diagnoses. We can make recommendations that says, okay, James, you could consider these particular problems as things to look at because on reflection of the session, you didn't actually look at some of these other aspects. So that can be fed back, and that's really smart. But I would hesitate to rely on AI diagnosis standalone alone.
Yeah, I can kind of see how that would work because it's got certain information from the interview that's happening there. So it would know that stuff. But obviously, especially in this scenario, AI can't actually see the patient or feel them or, see movement or anything like that. So it's still quite limited as to what it's sort of getting a secondhand interpretation of all that sort of stuff from words you might speak as the practitioner. So yeah, it's interesting, and who knows where it'll go in the future. But I think for now, taking notes is a good place to start. Yeah. I want to loop back to, you mentioned like to make this really good, you might need an understanding of prompt engineering. And I kind of feel like Prompt engineering is something that a lot of different AI systems use. It's basically the kind of instructions we give the AI to help get a better response from it. It's the context we give it. But a lot of people who are kind of new to this are going to be like, whoa, this has got words, it's engineering. I don't understand what's going on. Like, is this hard to use, Darren, or is it easy? What's it like?
No, it's really easy because it's like you would set up a template in Microsoft Word and just create a header and then provide context around that. So that's as complex as prompt engineering means. So what I mean by that is if somebody's come in and you're wanting to look at something like history of presenting condition, if you would like to collect, all right, the information, I want to know what region they've come in for, how long the problem's been around, previous treatment, and what I can do to help them out. All you do is just create that heading and just underneath and just say, document how long the problem's been around, previous treatment. And it's a natural language. So I think that engineering bit does scare people away. But because it's natural speaking, again, think back to that virtual assistant and say, okay, James, you've come on my virtual assistant. I want my notes to be done here in this section. Just collect a few of these areas, and then we're happy. We're going to get along really well. You don't need a coder. You don't need a computer nerd to actually help out with that side of things. And in our system, we've got probably around 150, 200 different templates. So the great thing is that if you're a practitioner of one discipline, it's great to actually check and see, well, what are the chiropractors picking up? What are the osteos? What are the myotherapists? What are the surgeons picking up and psychologists in some of these areas? Because the one thing across this journey of clinical note taking is everyone thinks they do really, really good notes. But the reality of it is the majority of people don't actually do good notes. It's something we never sign up for. We don't love doing. Well, it's a bit of a red flag if someone loves doing their notes, to tell you the truth. So you can then sort of go, how can I make my notes better? So prompt engineering is not a set and forget. It's actually, well, hang on, I'm picking up this awesome stuff and my notes are starting to get better. What else can I add into there? And what else can I exclude? What else can I give me really, really powerful summation of the session so I can come back to and go, cool, these are the key problems with these patients. This is what I did. This is the education I offered as well.
Mm. And I can imagine too, when somebody's working solo, it's like notes are purely for your own kind of benefit later on, or mostly. So you can have your own sort of weird style about them or something, and it probably doesn't matter as much. But if you're working in a clinical environment with more practitioners where someone might see more than one person, or if you are doing a lot of referrals or that kind of medical letters back and forth, it seems to be even more important to have a standardized way of keeping those notes. And something like this could be set up, and then everyone in your clinic or everyone that you're going to refer to all kind of has the same basis for their notes, the same kind of information being shared in the same way, would just improve that kind of communication and the patient care because of that, right?
Correct. Yeah. I mean, you're exactly right. And sort of doing notes, the reality of it is, yes, they're one of two reasons. They're either to document what you've done, which needs to be compliant. And one of the biggest reasons for medical insurance claims is the fact that there's poor documentation. So it's not just okay, they're coming back next week. What did I do? It's what happens if things go wrong? It's like car insurance and sort of going, well, I just keep paying this out and I've never claimed on it. Therefore, I'm just going to go with a token self-insured, or I'm going to, so it's not until you need it that you actually really want good notes. So if it can be done and there's that, wow, my notes are amazing and I'm not having to touch my keyboard, then that's even better, because that's one of the biggest protective, self-insurance you could actually do.
I love that. What would you say in general? Look, I guess where I'm going is I feel like we're talking a lot about something that's quite visual, and I've seen sort of demos of this software, so I can picture in my head what it looks like. But if someone is just listening to this podcast or watching us speak, can you give me a little description of like what's it actually like to open up this software and use it? Like, is it easy? Is it an app? Is it on your phone? Like, tell us a bit about what it's like to use in practice.
Yeah, so we've created both a web browser platform, which means that it can work on any device that has access to the internet. And we've also got an iOS app. So that works on iPhones, iPads. And all you do is you open up a session, put in that I'm just seeing James. The great thing with this is I don't have to put in emails, date of birth, all those things in fields that just take so long. So I could even enter you as Jay and just start the session. I just ask my patient's consent because that's part of capturing it with the Australian privacy principles in Australia. In the UK, it's part of GDPR compliance, and in America, it's part of HIPAA compliance, and we're compliant with all these systems. But I need to say, James, I'm going to use audio to text for my clinical notes. It's going to be stored in my practice software. Are you happy if I pick that up? And I just press record, and it just picks out what's clinical and what's not clinical. You and I might talk about the weather, we might talk about the football, we might talk about politics, and it's not going to then go in and sort of give those sort of didactic notes in terms of that info, which is great because people often think it's going to pick up everything that I talk, and 80% of my consult is about rapport building. So it knows what's clinical and what's not. You press finish, and then the notes are literally there straight away. Now, you have the option to do a post-session amend or add in. So let's say you've come in and I wanted to add in something that is of clinical relevance, but I wouldn't have said it in front of you. It might be something about your condition, or it might be about how you're just generally managing yourself. I can add that in, and then it builds out that extra information. Now, you don't have to go through it like you would in a template. So I don't need to say history of presenting condition is, and then it fills it in robotically. We just talk. And it might be something that you say at the end as to, my main goal is that I want to come in and get released through my lower back because I'm running the Melbourne Marathon in 3 weeks' time. And that will then instantly jump into where it's relevant in that section. So it knows so much about medical context. It knows so much about all of the different professions, and it just assigns it like a great little librarian, like a great virtual assistant, and you're away. So it's that easy, and people can from the podcast can jump on. They can download a trial and have a play. You can even do it with somebody at home. You can do it in the pub and sort of show off and go, I heard this podcast about this AI software, and on that iPhone, I've done it in pubs where there's been 600 people and there's lots of background noise, and you look at the notes and it's really, really good. So yeah, that's as simple as it is.
As long as you don't get notes by accident from the guy talking on the table next to you, telling some story at the pub. Whoops.
That touches on a really good point, because the quality of the transcript comes down to the quality of the microphone. So if you're doing an up close, and then iPhones work amazing, or smartphones work great because they're dealt to pick up conversations around the device. If you're in a consulting room and it's a 5 meter by 5 meter consulting room, then a pathetic little $5 microphone from Kmart is not going to pick up the consult across the room. So there's different horses for courses, and we have spent, or I personally in my clinics have spent thousands and thousands of dollars getting the right microphone, only to come back to real simple ones. So we've done all the hardship, and we advise users and say, okay, if you're using it in a gym space, use this. If you're using it in the consulting room, use more of a web conferencing microphone, and then you don't have to waste any money like I did.
Yeah, that's great. What would you say, like we've talked a little bit about the benefits being things like saving time and making the notes compliant and quite formal and detailed. What other benefits are there to something like this?
I think the best benefit is that you don't have to stay through lunch or evening having to go through a backlog of note taking. So that's great on its own. So in our clinic, and I'm still a clinician, it's great that everyone's engaging at lunchtime. People are saying, I don't have to do notes on the weekend. I don't have to do notes after hours. Doing that stuff that ultimately as healthcare providers, we're not actually paid for. Turning around things like medico-legal reports, great. But the biggest benefit is actually just being able to listen to your client and put away the keyboard, put away the templates that you have, and just go, James, like we're having now, we don't know which tangent we're going off on and what the next bit of pertinent information you're going to say. But if I'm truly listening to you as a client, the depth that you can get to, and going back to really engaging subjective examinations, has been the best thing that I've found, honestly. And I've got outcomes that I know I wouldn't have got if I was just head over a computer, because they sort of go, oh, is he finished yet to type? And then that information never comes out. Whereas if we just chat slowly, it's awesome.
Yeah, I love that. And I can imagine that I think we've all been in this situation, especially with maybe a GP or something like that, where they're asking a question, then turning around, completely facing the other direction, and you're looking at the back of the head while they're typing away at a keyboard. And it just breaks that rapport, and the conversation and the depth of it is way shallower if you've got that kind of break there. So being able to just, yeah, literally face your client, have a normal conversation, and know and trust that it's all being taken, the notes are all being taken correctly as you go. That's really powerful. What about, like, I mean, we're talking about one very specific use of AI, but I'm interested, this is really still quite new in this profession. AI in general has really only been sort of publicly available for a couple of years. What do you see as the benefits or limitations of AI in the broader spectrum of like the health space, and where this might go in the future as a technology?
Yeah, I think it's really important to know when to use which AI for which activity. So, a lot of people aren't really, they think of AI and they automatically think of this little robot sitting inside the computer. And okay, now I'm turning on my massage, my therapist, physio AI that's sitting in the computer. But the reality, that's what the prompt engineering does. And different softwares and different systems, whether it be open AI to start to use things such as creating tools for marketing and knowing how to write things for web blogs or helping with newsletters, you can start to utilize that really, really smart and start to create your own, what we call a chat, a GPT, which is a little app that says, okay, I've got Darren's clinic and this is how I want to run my weekly newsletter. And we do this now, and I turn out things that used to take 7, 8 hours, literally now in 10, 15 minutes. I can help with things like Google AdWords. I can tap into that to help me better understand what campaign, so I can work with my team on that side of things. So that can be what we call non-sensitive information, sort of where you're really creating content for creative and for your patients, and that alone is a really great use of AI, whether that be OpenAI, whether it be Gemini, Llama. There's lots of different tools out there, and it's a personal preference which one you would go for. And then there's tools like creating images, and for clinicians, being able to create royalty-free images using AI and a system, whether it be a system like DALL-E, or it means I don't have to spend a bundle to buy images of something that I really, really want for my website, from my newsletter, for just a handout. Then we've got the clinical notes that we've talked about, and also the letter and the report writing. Where it's all headed, I've been fortunate enough to travel around and see a lot of where things are looked at, like with AI, robotic treatment. And people are going, well, are the robots going to replace my hands-on skills? And I've felt those robots, and there's no way that they actually, at this point in time, that they're as good. However, in the surgical world, we've now got robotic spinal surgery and joint replacement surgery. So
Wow.
I was lucky enough to have a spinal surgeon come and present at our clinics recently, and he talked about the robotic technology in spinal surgery increases the accuracy from around 2 millimeter incision, which sounds okay, but not when you're talking about a spinal cord, to around 0.1 of a millimeter. Wow. So, the technology is out there, but I still come back and say it's not going to replace us as clinicians. Similarly, also going, okay, well, if I can do things like my marketing campaigns, do I need marketers? Well, yes, you do, because you're still not an expert. Or do I then sack my admin team because I can have a full virtual receptionist now that it answers the phone and does all my bookings? You want to look at it and go, well, what is my brand, and where am I best to allocate the menial tasks that are admin that the staff actually really doesn't like, versus productive tasks that are on building up your business, building up your brand, and getting new patients in and offering a better service to you and to your practice.
Yeah, I love that. I mean, my background is marketing, as I said to you earlier, Darren, and we do a fair bit of training around using AI for marketing, because I think that's one of the kind of easy wins for a lot of business owners. It's sometimes things people struggle with anyway, so having some help with that is really great. But I am really interested to see where, over maybe the next decade or even 2 decades, I can see that kind of access to AI is going to help in so much of our other more intellectual based activities, not just marketing, but all the admin, even things like diagnosis and yeah, like actual surgery. That's a mind blowing idea to have robotics hooked up with AI in the physical world as well. That's pretty crazy. Yeah, it's one of those things I think we'll look back in, I don't know, 20 or 30 years and think, wow, that was such a turning point in technology in history. And who knows where it's going to go.
Yeah, exactly. And I think that's the thing is this time last year, OpenAI sort of really came onto the roadmap and everyone's going, AI, there's the people that are going to have their head in the sand and go, well, it's going to pass through. It's just a fad. It's like, yeah, it's all bells and whistles and not actually sort of punch. And then there's the people who go, oh, hang on, that's a bit of a change for their professions. And hang on, well, let's work out where this is going. But my advice would be is if you start to delve in and know how to use systems, whether it be clinical notes or whether it be using something like AI and just using that natural speaking of just not settling for the first pass, but then saying, you know what, I actually want improvement in my output. This is what I want you to do. Okay, the image, it needs to be lighter. It needs to be a lady with left knee pain and she needs to look 70 years old and be holding an iPad. Just don't settle for that first output. It's going to be a skill that carries us forwards. And we talk about this prompt engineering. Sorry, I keep coming back to the word prompt engineering, but prompting about being a new language of 2023 and 2024. And I really do think if you don't jump on board and start to delve in, you can get a little bit left behind off this very fast moving train.
Yeah, I love it. I also want to ask you, Darren, personally, you've just dropped a couple of hints in this conversation about what you do. You're a physio, you run a clinic. What has led you from being a physio into being the CEO and co-founder of what I would call a high-tech online app company? What's that story about?
Yeah, no, I've had a crazy journey in healthcare, and I think my real value is health care and health tech and providing better outcomes for our patient. Now, I've been a clinic owner for better part of 25 years now. I've been clinical for about 27 years. Currently I've got 3 clinics based in Melbourne. We used to have more clinics based around Australia. So we bought and sold and all these aspects. As a result, when you start growing a bit of a team, you find a problem. And one of our initial problems was our practice management system was just breaking. And so I had to then partner, this is going back 20 years ago, with a practice management system to bring in changes to cater for our needs. So it wasn't ever that, hang on, we're going to sort of delve into the world of health tech. But we had to solve our problem. It wasn't available. So I reached out to those that did, and that got me into the healthcare tech space. I've created a few different products over the years that have evolved out of exactly what I mentioned, just giving better outcomes to patient. I designed pillows. I've designed, during COVID, we had, like all clinics, we actually had to then go to the nth degree for hygiene. So overnight, we created a business that was washed down treatment tables and massage table covers. And that's now grown into be sold all around the world. And, it's been an amazing journey from a little, we've got a problem, what's the solution, solve it. Now that's being made here in Australia. We've got a team that sells it. I don't touch that business anymore, but it's pushed out to all parts of the globe. And then going back when AI really got better, and what I say by better is AI, the libraries that you look at has around 1.75 trillion pieces of information. So it knows more about physio than I or any library in the world will ever know. It knows more about massage therapy. It knows more about the surgery than the surgeons. But it got better about 15, 16 months ago. One of my previous staff who moved from Australia over to work with her husband in Silicon Valley, he's a high-end software engineer, and she had to do all the compliance for notes over there. And they had a little bet one day because he's been working in AI large language models or AI for about 15 years. And he said, I bet I can make a system to do your notes as good as you do them, because she is fastidious with her clinical notes. And then that was the argument. And the argument just built. And 2 weeks later, he came back with a demo and said, here it is, test it out. And she just looked at it and goes, wow, like it's good. It wasn't great at the time, but it was a proof of concept. End of COVID's over there, lockdowns, travel restrictions. They actually brought their family back to Australia, and she started working again at one of my clinics. And Jason, who's one of the other co-founders, just came and said, Darren, I need to show you this technology, and I need your help to make it better and to get it to the clinicians. So I'm saying that because I'm not the computer tech person behind how this all goes, but I bridge the gap between the IT coders and the nerds and the clinicians that need the output. And that's sort of been my journey over the last year and a half. And we've now got thousands and thousands of users in all different sections of the globe. We've got professions from arts therapists to vets, massage therapists, allied health, physios, chiros, GPs, surgeons, you name it, it can be customized for the profession type and the professional. So I told you inside my brain's a little bit crazy, James, and you just opened up a can of worms.
I love it. I think it's probably testament to having that sort of creative energy, but also looking at it and saying, this is a problem, how can I solve it? And once you solve it, not just keeping that solution to yourself, but saying, well, how can I give other people access to this solution as well? If I'm solving a problem really well, why not share that and reap the benefits that come along with that as well? So that's really great. Good on you, Darren. I'm going to, just before we finish up, there's a couple of more sort of little practical questions that I know people will ask that I want to just drop in here. One is, you've mentioned, USA, the UK and Europe and Australia. And I just want to check, this is sort of compliant with all the kind of privacy and compliance regulations across the globe, right?
Yeah, that's the one thing I would actually encourage people when they are looking at a software. I'm very much educate the user. And if you come to patient notes, awesome. If you don't, you look at something else, just make sure it is compliant in your region. It needs to tick a lot of the boxes. And I have been tied up in the back end to know how much privacy, encryption, security has to happen for these systems to work in the medical space. You need to look at a medical specific system. And in Australia, make sure one ticks in with the Australian privacy principles. Those in the US are very familiar with HIPAA because all of their practice management softwares and communication needs to be HIPAA compliant, and GDPR for the sort of Eurozone region. But even if you're in Australia, make sure that the systems have actually got those other ticks, because they are really the gold standard in health privacy and private health information processing.
Yeah, that's great. And what about another practical question is, if someone does have some other booking software that they're using, how does this, or does it connect in with that? Like, are we taking notes here that we read here in patient notes, or are they stored in our other software?
Yeah, so we've done integrations with several practice softwares, and we can then pull the patient's name across and send it back in and do all that fancy stuff. However, globally, there's literally thousands and thousands of practice management softwares, and we'd love to be integrated with all of them, and hopefully one day we are. However, it will work with all of them, because if it's not one of our integrated softwares, when you do the notes, there's a section at the bottom says, yeah, I'm happy with that. I've edited it. This is what's my final notes. You click on mark as complete. It just sits on your clipboard. And then you go back into your
whatever
software, whatever it's called. And all you need to do is just Control V or right click or Command V, and the notes are straight in there. So yes, an integration might save 1.5 seconds that it's integrated, but it's not a showstopper. So it can sit in parallel with your practice software.
Yeah, that's great. And the last question, if someone is like listening to this and they're like, oh my goodness, this sounds fantastic. Like, is there a demo or something? How can they hook themselves up?
Yeah, absolutely. So patientnotes.app is the website. You can go there. There's videos, there's learning tools. There's also a free, fully working, no catch trial. It's not like one of those ones that you got to put in your mother, father, credit card, all those information. You just sign up. You just got to put your email address in, make a password, and then you're away. And that will be a fully working version. You can test it out. If you've heard this podcast, drop us a line through there and let us know. And we'll look after a lot of people listening to this podcast as well. And we can help with support. We can help with customize your prompts. So that's the place to start.
Sounds great. And I'll make sure the links for that are in the show notes as well. So if you're watching or listening, you can just click the link and go straight there and have a look. Thank you so much, Darren. Super interesting discussion today. I think Patient Notes sounds like absolutely amazing software, right on that cutting edge of technology and helping people. And your own story is really, really cool too. So thank you for sharing.
Thanks for having me on board. And as I said to any of the listeners, reach out to us. We're here to support you all.